and welcome everyone to the Gold Midwifery Conference 2026. I would love to say that it's almost around the corner here, and with me here today is one of our speakers, Dr. Miranda Buck. Welcome, Miranda.
Thanks for having me again. It's lovely to be here.
It's wonderful to have you back. You've been with us before, so you're back by popular demand. And I can't wait for our conference. We get started February 2nd with our open access keynote presentation that's available to everyone. And yeah, and you are part of the main presentation. And your title of the presentation is Let Them Cook Infant Feeding Support for Gen Z and Gen Alpha. So before we jump into that, tell us a little bit about yourself and where you are in the world and about your professional background.
I live in Melbourne, Australia, so it's super hot at the moment. And I've been here for 20 years, but originally I came from London. I'm a neonatal nurse and a lactation consultant and a midwife and a maternal child health nurse. So it's like a bingo card. I'm collecting them all.
Wonderful. So let's talk a little bit about the topic here, about feeding support for Gen Z and Gen Alpha. I'm so glad we're doing this because there is quite a little bit of a shift, how these generations see the world, how they experience it, and what kind of expectations they have of parenting. And they often come with a lot of knowledge already, right? They're quite educated when it comes to the topic. And so tell me a little bit, what is different? What do you see in your practice, and what kind of encouraged you to, or to have this topic here with us at Gold?
We know that there are real differences between the generations, particularly in our youngest cohort, the Gen Alpha. They were really impacted by COVID and by
Mhm.
their growing up in a within the technology, and how that has influenced how they interact with each other, how they access knowledge, and how they what they expect from healthcare, and how they live their lives. And I think particularly I've noticed that with my colleagues, because we have some really young midwives coming through, and just working with them, it's just been really delightful listening to the way that they interact with mothers now and the kind of language they use. And that was kind of what inspired me for this. It's like how I have had to adjust my practice as a lactation consultant and as a midwife when I'm teaching, to be able to communicate both with my colleagues and with new parents, and the kind of phrases and ways of conceptualizing what's going on, which I'm having to adapt, and what I've found to be helpful and successful in the work that I do.
Absolutely. Yeah, sounds wonderful. Yeah, and you're right. They have many of them I find are very educated. They get a lot of, they're very curious. They want to, it's not so much about doing it right, but they have a really unique outlook, how they perceive they want to parent as well. And they come with already a lot of information to us often. Now some of the information we have to see where they're getting it from. You mentioned they have a different approach how to, find information. Of course, many of them are very involved on the internet. They have, on social media, especially TikTok and such, right? So, they are. It's wonderful to be able to get all the information, but it's also tricky, right? Because the information they're getting there might not always be accurate or, or good.
Oh, absolutely. So the huge influence, particularly of short videos of TikTok and of following influencers. So rather than turning to expertise, of
Mhm.
listening to their peers who are relatable to them, and that can be great, and it can also be problematic.
Right, absolutely. It can also be overwhelming, right? The information
Mm.
flood they're receiving. I mean, they're online 24/7. There's like this flood of information, influencers, as you mentioned, who often want to sell something rather than really give good advice. There is some great information as well. There's some people, really knowledgeable and skilled on the internet as well. But what do you see? What kind of expectations are these Gen Z, Gen Alpha coming in with? What do you see in your practice?
Well, you've hit the nail on the head there with the idea of them being a bit overwhelmed. So there tends to be information overload and overwhelm, and so simplifying the messages is really useful, and just trying to break it down to what's the most important thing here, now, today, and not worrying quite so much about the kind of all the various millions of different options that they have. So I think we talk a lot about responsive parenting these days, and that fits in actually really well with some of the kind of the ethos of Gen Z and Gen Alpha. They are
Right.
tending towards being more anxious.
Hmm.
There's lots of different reasons why that's happening, and so the idea that we co-regulate with our babies, and that our job as parents is just to keep them calm, to keep them in the kitchen, to let the whole situation cook. That actually works really well for them. So
Hmm.
I'm really optimistic about the
Yes.
kind of parents that they're going to be,
Hmm.
because how they respond to just the idea that we don't have to have the kind of rules and regulations and strict routines that actually made mothers really stressed
Right.
back in the 90s, and that we can, everything can just flow a bit more.
Hmm. Flow a bit more. I love that. And especially what you mentioned also about the co-regulation. It is so true that it really speaks to this the new generation, right? But also, that is absolutely wonderful. But on the other side, there's a lot of apps available. There's an app for everything now, right? We know that. And and what I'm a little bit worried about that they are relying too much on these. Okay, can we measure, how much breast milk you have? Everything can be measured and qualified. So is that a concern, or do you see like no, they are really in tune and they just use the app when needed, or is it helpful? Is it not? What do you see?
Yeah, I think part of our role as midwives is to help them find the tools that are going to be reassuring and helpful for them. So it is useful sometimes, day 4, day 5 down the track, when I'm asking women how frequently the baby is feeding, and they can pull up an app and they can show me in minutes how long it's been going on. But I'm not sure I really want women sitting there timing every single
Mm,
feed for weeks on end.
yeah.
And I think that's one of the things that we were just like, actually, babies know what they're doing, and
Hmm.
we can relax about that a little bit. So I think, yeah, just finding that balance between, yes, there are tools that are really helpful, but also
Hmm.
babies know what they're doing, and we can trust them and just let things flow.
Absolutely. You mentioned that you work now a lot with young midwives coming in. I think that's exciting. I think there's some great midwives coming out of that generation. I'm very excited myself there. What would you like to say to older or seasoned midwives who've been doing this for like 30 years now? Do you see when they are talking to either their clients, their young clients, or their students, what do you observe sometimes what we could do better? Or what maybe not so much we're doing something wrong, but how can we adjust to be, really a good partner in education, also as a midwife with younger clients and such. Give us some tips here.
Okay. I think I remember some years ago reading somewhere that if you're over the age of 40, you should have somebody under the age of 30 as your mentor, because times change so much, and
Oh,
that
that's
we
good.
can learn. And I think that's the idea, that the learning is bidirectional,
Yeah. Hmm.
and that the young people that they're coming through university, and they have the academic background. They get taught the most up-to-date recent, one would hope, up-to-date recent education, and that sometimes we need to listen to them and let practice change. So
Mm,
it's really hard to change practice, and we know that it takes on average sort of 7 or 8 years for research to become embedded in practice, and that process can be really difficult to let go of our habits and the way that we've been doing things and what's always worked for us. But that change needs to happen, and particularly when it can be really frustrating for young midwives when they feel that they know what they're doing, and they just can't trust themselves, and they're getting kind of pushed back all the time into practices that they just don't want to do. So I think that working in teams and having those open discussions about how everyone's feeling about their practice and what they're doing, and letting them practice, and then seeing how that feels and what the outcomes are. I
mhm.
think that's kind of where we need to be going, because yes, there is a role for expertise and for experience, but there's
Yeah.
also for novelty, and for kind of for newly trained people who have a lot to give.
That speaks to me a lot. I feel like I loved how you said this is like in both directions. You know, they can be mentors to us, we are mentors to them, and learn from each other, and adapt, and really get the best of both worlds, like from the seasoned midwives also, and the younger ones who are just on the pulse. They're just learned the latest research in their education and such. So it makes a good team, I think, as well. So last question here, Miranda. What are you hoping after watching your presentation? What are you hoping our attendees will take away from it?
I think the most important thing, the thing I really wanted to get across here is that the key idea that I'm trying to push in my work is that babies need to spend their time in the kitchen, that they need to be close, that they need to be cuddled, and that the ideas of swaddling babies and putting them down to sleep for 3 or 4 hours is not helpful for anybody. It's not helpful for
Right.
mothers. It's not helpful for babies. And we need to start thinking about what is natural, normal, helpful, and developmentally appropriate for babies, and embedding that in our practice and supporting mothers to hold their babies skin to skin as much as possible, particularly in the first 3 or 4 days after babies are born, and the language that we can use to reassure women that this is safe, and that this is a good thing for them to be doing, because there's still that persistent idea that a good baby is a swaddled sleeping baby.
Hmm. Oh, absolutely. Well, thank you so much, Dr. Miranda Buck here. Thank you for coming here and chatting with me. And also, I'm very much looking forward to your presentation at the Gold Midwifery Conference 2026.
Thanks a lot for having me.
And some information now for our viewers. If you are curious now and would like to find out more about Miranda's presentation, we invite you to go to goldmidwifery.com. There you find out about all the presentations of the conference. Of course, you can also sign up there for your free keynote presentation. Make sure you share that with your friends and colleagues in the field. And we hope to see everyone in the conference. Bye bye, and hope to see you there.